Okay, for our One Health project, we're going to be focusing on zoonotic diseases and how that applies to the One Health approach. What are zoonotic diseases? A zoonotic disease is a disease or infection that can be transmitted from vertebrate animals to humans or from humans to vertebrate animals. Zoonotic diseases are caused by various harmful germs like viruses, bacteria, parasites, and fungi. Once humans or animals are infected with these harmful germs, they may begin to have mild to serious illness, and they can sometimes even cause death. Some examples of these diseases are rabies, salmonella, avian influenza, bubonic plague, Lyme disease, and so many others. Zoonotic diseases are very common in the United States and all around the world. Research states that at least 60% of human emerging infectious diseases are zoonotic. Because of how common these diseases are and how many of them still exist to this day, it's extremely important we talk about them, especially in regards to the topic of One Health. Speaking of One Health is a collaborative effort working locally, nationally, and globally to attain optimal health for people, animals, and the environment. When discussing One Health, it's important to talk about the One Health triad, which discusses the interconnectedness of animals, humans, and the environment. When it comes to environmental health as One Health, significant threats to human and animal health happen as a result of contamination or destruction of the environment. The biggest threats include population growth and climate change. When it comes to animal health as One Health, this is considered to be the most important connection to understand why healthy animals are important for the environment and humans. Human Health as One Health discusses the ways in which animals and the environment enhance our well-being. Common threats include climate change, cancer, infectious diseases, diseases of nourishment, and many others. The overall goal of One Health is to better understand and solve today's planetary health problems by evaluating challenges that link humans, animals, and the environment.
The rates of zoonotic diseases are growing rapidly. Zoonotic diseases account for over 60% of infectious diseases globally. Of all new or emerging diseases, 75% are considered zoonotic diseases. There are many challenges to managing the spread of zoonotic diseases. A lack of resources and preparedness can be challenging. A scarcity of the appropriate resources, lack of preparedness, and lack of coordinated efforts on behalf of health officials and local, state, and federal governments can result in the spread of a disease. Globalization is a challenge to managing the spread of zoonotic diseases. Due to international travel and trade, zoonotic diseases have the ability to spread rapidly across borders. Land use and urbanization can be challenging. Humans continue to encroach on wildlife habitats by deforestation, causing more frequent encounters between humans, animals, and vectors. Climate change is also a challenge. The increase and intensification of climate change can expand the range of vectors like mosquitoes, increasing the spread of zoonotic diseases. And lastly, inadequate public health resources is a challenge to managing the spread of zoonotic diseases. Lack of healthcare infrastructure, poor sanitation practices, and inadequate disease prevention contribute to the spread of zoonotic diseases. The economic and health impacts of zoonotic diseases are great. Healthcare costs and family burdens. Zoonotic diseases can require expensive medical care and treatments, and the cost can be a huge burden to patients and families, as well as an overload on the healthcare system and its personnel. Loss of income and family life complications. A serious zoonotic disease outbreak can lead to lost income for individuals and families, the loss of ability to work, and the disruption of a family's daily life pattern. Other economic losses. A zoonotic disease outbreak can also burden and financially damage businesses and have huge negative impacts on industries like tourism, trade, livestock, and agriculture. High mortality rate. Zoonotic diseases can lead to pandemic-level outbreaks, resulting in a high rate of illnesses and deaths. Next slide, please. It's important to understand how zoonotic diseases are transmitted so that you can protect yourself and your family. There are 4 main ways that zoonotic diseases are transmitted. Direct contact transmission. Zoonotic diseases can be transmitted directly through an infected animal's blood, mucus, saliva, urine, feces, or other bodily fluids. Examples of this include petting or touching animals and bites or scratches from infected animals. Indirect contact transmission. Disease is transmitted indirectly through contact with contaminated surfaces or objects or where infected animals live or roam. Examples of this include pet habitats, chicken coops, and barns. Vector-borne transmission. Zoonotic disease is transmitted to humans through the bite of an infected insect. Examples include mosquito, flea, or tick bites. And lastly, food or water-borne transmission. Disease is transmitted through undercooked meat or eggs, unpasteurized milk, or raw fruits or vegetables contaminated with animal feces from an infected animal. Disease can also be transmitted through the consumption of or contact with water that's been contaminated with feces from an infected animal.
Today, we will discuss a case study about COVID-19. We will discuss the specific organism or factors that causes a disease. In the case of COVID-19, the causative agent or the culprit is SARS-CoV-2, a type of coronavirus that triggers the illness in humans. It originated in Wuhan, China in December 2019. It was likely originated in bats with the intermediary hosts like pangolins that are considered an intermediate host, but still subject to scientific study. The initial spread in early cases is linked to the Hunan seafood market. The spread in human-to-human transmission spread through respiratory droplets from coughing, sneezing, and talking. In March 2020, the WHO declared COVID-19 a global pandemic, and by 2014, over 700 million cases was confirmed and 6.9 million deaths. There were multiple variants such as Delta and Omicron. Well, how do we prevent it? So now we can look at preventing future zoonotic diseases by early detection and surveillance by monitoring animal population, especially bats, and for potential threats, and strengthening One Health initiatives to address human, animal, and environmental health. For COVID-19 prevention measures, we have a global campaign for vaccinations and public health measures such as quarantine, contact tracing, and masks to reduce transmission. Lastly, we can reduce contact with wildlife and promoting conservation to prevent future zoonotic spillovers.
Good evening. Everybody can hear me?
Yes.
Okay. I'm going to speak today about human activity and ecosystem changes. First, to speak about human activity, deforestation. Deforestation expands human, wildlife, and contact zones. An example of this is the virus spillover from bats to humans in deforested areas. Secondly, urbanization. Urbanization creates hubs for zoonotic transmissions. Example, urban wet markets linked to the SARS outbreaks. Wildlife trade. Wildlife trade increases the risk of interspecies disease spillover. Example is COVID-19 was likely linked to the wildlife markets. Shifts in habitat and range of vectors. Warmer temperatures expand the range of mosquitoes, increasing malaria and dengue fever. Altered wildlife migration patterns. Changes in bird migration linked to avian influenza outbreaks. Increased extreme weather events. Flooding and natural disasters create breeding grounds for pathogens like leptospirosis. An example of this is the higher temperatures in Europe have increased the presence of Lyme disease due to the expanding of tick habits. Animal health and zoonotic disease emergence. Why is animal health important? Over 70% of emerging infectious diseases originate from animals. Livestock and wildlife play a critical role in zoonotic disease transmission. Role of livestock in zoonotic disease emergence. Intensive farming practices increase the risk of zoonotic diseases like avian influenza and swine flu. Livestock serves as an amplifying host for diseases that spread to humans. Examples of this is the brucellosis transmitted through unpasteurized milk through direct contact with infected animals. The Rift Valley fever linked to the infected livestock and mosquitoes. Wildlife acts as reservoirs for pathogens such as rabies, Ebola, and coronaviruses. Habitat encroachment increases human-wildlife interactions, heightening spillover risks. An example of this was bats as reservoirs for the Nipah virus and SARS-CoV-2. Animal surveillance and vaccination. The importance of surveillance is early detection of diseases in animal populations prevent zoonotic outbreaks. Example of this is wildlife monitoring for avian influenza hotspots. Vaccination strategies for this is vaccination of livestock reduces transmission to humans. Example, brucellosis control via livestock vaccination campaigns and canine rabies vaccination programs have drastically reduced human rabies cases globally. The need for collaboration. Veterinarians and ecologists' roles in One Health. Veterinarians key in diagnosing, treating, and vaccinating animals. Ecologists, they study ecosystems to prevent zoonotic risks and mitigate habitat-related spillovers. The collaborative success stories, integrated efforts between veterinarians and ecologists have helped control anthrax outbreaks in African wildlife parks.
Environmental health and zoonosis, link between ecosystem health and disease outbreaks. Ecosystem health plays a crucial role in preventing zoonotic diseases like COVID-19 and Ebola. Habitat destruction and wildlife-human interactions driven by activities like deforestation and pollution are key contributors to those outbreaks. Contaminated water sources lead to diseases like typhoid, while habitat destruction increases zoonotic spillover risk as seen with the virus. Strategies for collaborations, zoonotic diseases, integrating health sectors, foster collaboration between human, animal, environmental sectors, address zoonotic risks with cohesive policies, enable real-time exchange between health, veterinary, and environmental agency, strengthening global surveillance, partner to detect and respond to zoonotic threats, create uniform reporting systems, train locals to report unusual animal health events, combine medical, veterinary, and environmental science education, study zoonotic disease dynamics and prevention, and develop diagnostic tools and outbreak prediction models. Future direction and benefits. Preventing future outbreaks through a One Health approach. Integrating across sectors. Collaboration between human, animal, and environmental health sectors to identify and mitigate risks early. Disease surveillance. Enhance monitoring systems to detect zoonotic diseases before they spread wildly. Education and outreach programs to promote sustainability practice and reduce exposure to health risks. Improve pandemic preparedness. Strengthening international partnerships to streamline responses and resource sharing. Investment in rapid diagnostic tools, vaccine platforms, and data modeling. Development of adaptable and evidence-based policies for emergency responses. Early prevention and efficient management minimize the need for expensive treatments and hospitalization. Healthier populations contribute to greater productivity and reduce absenteeism. Every dollar spent on prevention and preparedness yields significant savings by averting potential losses in healthcare and economic sectors. Conclusion: Zoonotic diseases are a major threat driven by ecosystem imbalance and human activity. Integrated solutions are essential to address these challenges. The importance of One Health connects human, animal, and environmental health to ensure global health security. Call to action: support research to understand disease drivers, advocate for policies promoting sustainable practices, and educate communities on the One Health approach for long-term health benefits. These are some of the references that we've used for the presentation that we did today. Thank you all for tuning into our presentation.